Hey guys, this is Dr. Hub. Today we'll look at the factors that impair the bone healing and cause the non-union. So beginning with the biological etiologies. So under local, there is excessive soft tissue stripping. So there can be excessive short tissue stripping. Next is the presence of the bone loss. There is presence of bone loss. Then comes the presence of the vascular injury. There is radiation as well as the presence of the infection. Then we move on to the systemic. So what happens with the systemic? So under systemic there is age. Under systemic there is age. There is chronic diseases. There is also the metabolic endocrine abnormalities. So metabolic as well as the endocrine abnormalities, which includes the vitamin D deficiency. There is also the presence of the malnutrition and smoking. Then we move on to the mechanical etiologies. So under the mechanical etiology, there is malreduction. So under malreduction, there is malposition, malalignment, malposition, there is malalignment, as well as presence of the distraction. So under the mechanical etiology, there is another heading, that is the inappropriate stabilization. There is inappropriate stabilization. So under this, it includes the insufficient or too rigid fixation. There is insufficient or too rigid fixation, and there is also the inappropriate implant choice or position. There is an inappropriate implant or choice or position.